Welcome to this presentation on the turf disease take-all patch. Take-all patch is a serious disease of creeping bentgrass. Poa and Festuca species may be attacked, but the severity and symptomology are minor. This is, however, not the case with creeping bentgrass, where severe injury can occur. The pathogen that causes take-all is Gomonomyces graminis. Symptoms may appear any time from late spring through late summer. Pathogen infection of the roots, however, occurs during the cool, wet periods in spring or fall. Take-all symptoms appear as circular patches ranging from 6 inches to over 3 feet in diameter. The patches in this case are over 3 feet. Although symptoms are most common during the summer months, they can occur during late winter, as was the case in this photograph. The pathogen attacks newly established bentgrass turf on fumigated soils or on high sand root zones. In this case, this is a newly constructed T with a sand root zone. Take-all can also occur on virgin soils. In this case, this golf course was recently constructed and established in a cleared forest area. Take-all patch symptoms are evident. Take-all is strongly associated with soil pH, with the disease most severe at high pH soils, those normally in the mid to high 7s. During hot, dry periods of summer, take-all symptoms are quite evident. Under moisture stress, the patches appear as a bronze to reddish-brown color. Under less stressful conditions, the patches appear more yellow in color. Minimizing moisture stress in the diseased area is one of the cultural practices that helps minimize symptom severity. Symptoms in late winter or early spring appear a more whitish to gray color. In some instances, the symptoms may be confused with microdochium patch. Gomonomyces graminis is a root pathogen that has previously been mentioned as infecting creeping bentgrass roots during spring and fall. A fungal sign of this pathogen is the presence of ectotrophic runner hyphae. The arrow in this photograph is pointing to an ectotrophic runner hyphae. Ectotrophic means on the outside, and runner hyphae are thickened hyphal strands. Ectotrophic runner hyphae are important because they initiate the bentgrass root infection process. Again, this is another example of an ectotrophic runner hyphae on a creeping bentgrass root. The presence of ectotrophic runner hyphae does not necessarily mean it's Gomonomyces. A number of root pathogens also produce runner hyphae. It is the combination of symptoms, turfgrass species, and the presence of ectotrophic runner hyphae that help provide a quick diagnosis of this disease, in many cases similar to a circumstantial evidence in a log case. To truly identify the pathogen may require weeks or months to properly culture it out on media and do the appropriate identification. Research has led to newly developed molecular techniques that may provide for a quicker identification. Cultural controls for reducing the likelihood or severity of take-all patch include lowering the soil pH. Take-all patch is not a serious problem at pH of 6.5 or below. Practices such as using acidifying fertilizers where appropriate will help reduce pH. Checking the pH of the irrigation water and top dressing material may help reduce the potential for alkaline substances being applied. Additionally, maintaining adequate soil nutrient levels. Nutrient deficiencies are present. Take corrective measures, especially if manganese is deficient. Manganese deficiencies have been shown to enhance the severity of take-all patch. There are fungicides available for control of take-all patch. Control is best achieved preventatively, which would require applications be made in either spring or fall.